If you're anything like me, you like learning anatomy through sports injuries. This is episode 12, Learning Anatomy Through Sports Injuries. I'm sorry. Paul George, August 1st, 2014. It's a Team USA FIBA World Cup intra-squad scrimmage. Paul George is on the blue team here. Kevin Durant, outlet pass to James Harden. Paul tries to go up for a block. You kind of saw it there, but they did get another angle of it on the main broadcast. So his leg connects with the bottom of the basket, and his leg snaps in half. That's not good if you're Paul George or any fan of basketball. So why did that happen? As you can see in this picture, his foot is flat on this basket here. And so when he's jumping towards the baseline, all of his momentum is going towards the baseline, but his foot stops. So all that momentum is going to go through that foot up into his shin, and that's why it snapped in half. So obviously it's a tibia and fibula fracture here. The fibula being the smaller one on the outside of your leg, and the tibia being like where your shin is that you can feel. So obviously it was a compound fracture, and they compared this to the Kevin Ware injury. You couldn't see it here because he did have a bunch of socks and some leg sleeves, but it was a compound fracture. He did have to get carted off the court here. A lot of research says that a bone fracture is better outcomes than like an ACL or a soft tissue fracture, which when you think about it, bones heal a little bit faster than ACLs and soft tissue. So it was actually not necessarily the best case scenario for Paul George, but it definitely could have been worse. And again, it was only a scrimmage against his teammates of Team USA. So what did they do for Paul? He had surgery and realignment. They put a rod in his tibia. Now there was danger for infection because it was a compound fracture, so they did spend time to clean out that wound. Physical therapy to return to sport. We obviously know Paul George is still active in the NBA right now. You can see he's been all around the league. He was actually involved in the trade that put Tyrese Halliburton on the Pacers. So we've talked about him once before, but that's a little bit of lore. But he did begin physical therapy 3 weeks post-surgery, got back to practice 6 months later. Played, I think it was 6 games in 2015 until he had another knee surgery. And it's kind of been on and off like that for Paul George in his career. But nonetheless, he's still playing on the 76ers, and that's Paul George.